Well, we did have a session this morning which was very interesting.
Donc, je vous remercie d'être...
Thanks very much indeed for coming back after lunch. I'd like to reconvene the conference so we can carry on our very useful discussions. This morning we heard a series of presentations and they showed really the possibilities for cooperation between veterinary experts and farmers in combating this scourge of antibiotics resistance. But this afternoon now, and we're very happy indeed to welcome the Commissioner in charge of Health and Food Safety in the European Commission, Dr. Vytenis ANDRIUKAITIS, as well as the Minister of Agriculture for Luxembourg, President of the Council, responsible for consumer protection, Mr. Fernand ETGEN from Luxembourg. We're going to have actually a sort of a panel, bit of a roundtable discussion this afternoon, building on this morning's work. But before going to that, I'd like to invite the Commission to open this afternoon's session by sharing a few thoughts with us. Commissioner.
Okay, it will be better here. Okay.
Yeah.
Okay. Dear Minister Fernand again, dear Didier Delmotte, ladies and gentlemen, colleagues, it is a great pleasure for me to address this important conference co-hosted by the Luxembourg Presidency of the Council, la Fédération Européenne pour la Santé Animale et la Sécurité Sanitaire and the European Commission. I am grateful to all of those who have helped to organize this event and bring everyone together here today. Following my appointment as Commissioner, European Commissioner for Health and Food Safety, now almost 1 year ago, one of my first tasks was to identify the main priorities on which I would focus during the course of my 5 years mandate. I drew up 2 lists, one for health and another for food safety. Under the health pillar, I selected prevention, promotion and protection, of course risk factor management in this context, reducing the burden of chronic diseases, healthcare systems, protecting citizens against cross-border threats, and antimicrobial resistance. Under the food safety pillar, I choose crisis management, food safety, and better regulation, a revision of the decision-making process for genetically modified organisms, very important topic, endocrine disruptors, cloning, animal welfare, food labeling, and antimicrobial resistance also. As you may have noticed, antimicrobial resistance was unique in that it featured in both my health and food priorities, reflecting that the fact that antimicrobial resistance spans both pillars of my portfolio. Why? Because people are dying when antibiotics don't work. First slide, please. You see in this slide that the major new types of antibiotics have been developed in over the last 30 years, and last antibiotic was created in 1987. 1987. It's very important. As you see how many years we live without new antibiotics, from 1987. This week, a very interesting article was published in the International New York Times on IMR. This article is very important, taking on the superbugs. And here it's very important sentence. In most large-scale livestock operations, antibiotics are mixed with water to prevent illness and encourage growth, which contributes to the breeding of drug-resistant bacteria that enter the food supply. It's from New York Times. There is a quote there from Ellen Silbergeld, professor of environmental health services, where she says that she, I quote, was born at the dawn of the antibiotics era, and probably before I died, the antibiotics era will be over. This is a fact. Since 1987, no new antibiotics have been developed, and the resistance continues to rise. With the same trend, we will have 10 million additional deaths annually by 2015, more than killed each year by cancer. This is really a human tragedy, but it also threatens the stability of health systems and puts in danger many great achievements of modern medicine, making it impossible to fight infections that have been manageable for some years now. If the trend continues, it can undermine or even halt the treatment of chronic diseases. Slide second. Increased resistance to antimicrobials, especially antibiotics, not only has a direct impact on human and animal health due to the failure in the treatment of infectious diseases, but also carries a heavy economic cost. In this slide, you see only the cost of hospitalization, but the cumulative loss of economic output would reach 60 trillion to 100 trillion United States dollars in 35 years, according to the recent report from the United Kingdom government. Slide 4, please. Antimicrobial resistance in Europe, as you know, which countries are more or less affected, and it's very, very illustrative. An accumulation of factors, including the excessive and inappropriate use of antibiotics and poor infection control practices, could bring us back to the pre-antibiotic era, with massive negative consequences for people's health, not only in Europe, but across the entire world. Next slide, please. The statistics and predictions are alarming. At global level, 10 million lives could be lost per year by 2015. In addition, consumption of antibiotics in human medicine grew by almost 40% between 2000 and 2010. Globally, livestock consumed 63,000 tons of antibiotics in 2010, according to the United Nations. It is plain to see why many are forecasting that the magnitude of IMR as a global issue will reveal that of climate change. Slide 6. The IMR concerns not only people but also animals. The superbugs are being transmitted through the food and water supplies. These resistant organisms know no borders. They are part of our industry, farming practices, cities, hospitals, water drain systems. This clearly shows that IMR is a problem which requires global action and also requires one health approach across human and animal sectors. To be efficient, we need to act in all sectors: public health, healthcare, food safety, biosafety, environment, research and innovation, international cooperation, animal health and welfare, as well as farming. We need more prevention and control of IMR through strict hygiene, especially introducing those rules, and appropriate use of antimicrobials. We need more research. We need greater incentives to develop effective and affordable new antibiotics. We can only succeed if all of us play our role. Medical staff, veterinarians, farmers, environmentalists, scientists, epidemiologists, pharmacists, engineers, livestock operators, and also the legislators. I invite all the European Parliament members to join us in the fight against IMR. This is not the question of north part of Europe or south part of Europe when we see discussions on veterinary medicine and medicated feed. That doesn't know geography. And we are ready to invite all our 28 member states to understand that we need an effective legislation in one health approach. Please show slide 7. We also need strong partnerships across the world. I am glad to see that there is an increasing attention on the global level to this issue. Indeed, one might say that 2015 could even be seen as a year that IMR truly came of age on the international political stage, as you see. The ongoing national and international initiatives on IMR in areas such as surveillance, vigilance, the regulation of antibiotics, infection prevention, and research have led to some important actions worldwide. This year we have seen the emergence of the WHO Global Action Plan in May, the Food and Agriculture Organization resolution on IMR in June, the G7 statement of IMR also in June, as well as the action package in IMR of the Global Health Security Agenda. Yesterday I attended the Transatlantic Task Force on IMR meeting. OECD economic study and the World Animal Health Organization guidelines are ongoing. And of course, fighting IMR has long been a priority for the European Commission. Indeed, the Commission launched a 5-year action plan to combat IMR back in November 2011. This EU action plan involves all sectors and aspects of IMR: public sector, healthcare, food safety, biosafety, environment, research, innovation, international cooperation, animal health and welfare. It aims to strengthen the prevention of and control of antimicrobial resistance across all sectors and to secure the availability of new antimicrobial agents. Now, nearly 4 years since the action plan was launched, I am pleased to know that important progress has been made in Europe. Furthermore, the action plan has certainly been instrumental in increasing international awareness of this issue. But despite this progress, I am certain we can be more ambitious in this area in the future. This is why I have recently launched an evaluation of the action plan with a view to making informed decisions on what additional measures could and should be taken in the medium and long term to combat IMR in the European Union and across the world. In particular, I believe the European Union is a leading place to serve as a global leader and catalyst in the fight against IMR. Fueling the political momentum for real and lasting change. Ladies and gentlemen, IMR can be defeated through changes in attitudes and practices on the ground, and in particular in hospitals, in everyday general practitioners' work, and of course also in case of animals and on farms. I have seen some excellent examples in the Netherlands earlier this year, where monitoring is done in the farms and around those areas where the concentration of farming is high, and the hospitals are able to identify patients that are at risk, separating them from other patients if they have temperature, and it's a very excellent example of One Health approach. This is a real One Health approach, as you know. This approach is also enshrined in the Commission proposal to revise EU laws on veterinary medicine and medicated feed. As you see this excellent picture, we must be very careful on this picture because of antibiotics must be banned in such technologies. We seek to improve our laws and to use on the use of antimicrobials in animals, including incentives for developing new antimicrobials and the possibility of reserving certain antimicrobials for people only. The broad aim is to improve access to veterinary medicines in the EU and to strengthen European Union actions to fight antimicrobial resistance. The proposed rules were developed with the needs of all stakeholders from the veterinary sector in mind, including competent authorities, industry, and farmers. It brings me back to today's event where we are discussing the use of antimicrobials for the treatment of farm animals, and in particular how their use might be reduced and otherwise improved. I looked forward to taking part in the panel discussions. And of course, let me finish by reaffirming my resolute commitment to doing all I can to help combat IMR, both within the EU and internationally, throughout the duration of my mandate as Commissioner for Health and Food Safety. I know that One Health approach needs in cooperation, but especially in coordination. But I know how it is difficult to encourage all actors, all stakeholders to coordinate our activities, because all like word coordination, but nobody likes to be coordinated. It's a huge challenge for us. I hope you are on board with me. Let's create synergy of our actions and keep our antibiotics effective. Thank you.
Merci, Monsieur le Commissaire, pour vos paroles très...
Well, thanks, Commissioner, for being so committed in your presentation, and thank you for reminding us all of this crucial significance of this particular subject for today's meeting. Mr. ETGEN, who you are, of course, the Minister of Agriculture of Luxembourg, I'd like to welcome you. Thank you very much indeed. Thank you very much indeed, sir. Dear Ministers, dear Commissioner, dear representatives of the European institutions, and very dear participants, I don't have very much time, I must admit. Let me make that clear. Yesterday, we had an agri-fishing council in Luxembourg. Today, I had another council of ministers in Luxembourg itself. But despite that pressing schedule, it's a great pleasure for me to be here with you today at this conference in Brussels within the framework of the Luxembourg presidency, closely cooperating with FESS and with the European Commission. The subject of this conference is antimicrobial resistance. This particular subject concerns us all from the point of view of public health, of course, and I'm particularly concerned because one of my functions is the Minister in Luxembourg for health and food safety relating to animal health, which has direct influence on the issues that we're discussing on animal health and elsewhere. Farmers are the proprietors of animals which provide production services and goods into our food sector, and they need to guarantee animal health and also food security. The best ally to farmers in achieving this objective, without doubt, is the veterinary colleague, the veterinary expert, who is very well equipped via his or her expertise to be able to diagnose, carry out the diagnostic exercises of the holdings, of the herds, to understand, to diagnose, to prescribe medicines and take the necessary steps, including prescribing antibiotics where necessary, and then also carrying on by supervising ongoing maladies and diseases amongst animal holdings. And that can lead to an improvement in the situation, correction of problems and diseases, and as a result can also lead to the production of foodstuffs which respect well-being, health and well-being of animals as well. The veterinary experts in their activities and farmers can also build on and work together with the inputs and contributions from scientists and academics and research laboratories that contribute to more targeted efforts to provide proper frameworks for the use of antibiotics, so that we can on that basis together cut down on antimicrobial resistance, which are the occurrence of bacteria in breeding, and that also as a result can cut down the damaging effects of such occurrences in the range of public health policies. I'd like to thank all speakers this morning and throughout today's meeting for all their very interesting presentations. I'd like also to thank everybody, all colleagues and friends, for participating in this conference, because these are useful discussions, very difficult discussions in a very technical and complex area that certainly serve the general public interest.
Merci, Monsieur le Ministre.
Well, thank you, Mr. Minister. I'd like now to give the floor to Monsieur Remy Petiot, who is a representative from the European Parliament. Thank you very much indeed. Mr. Minister, Mr. Commissioner, ladies and gentlemen, on behalf of Madame Françoise Grossetête, could I thank on her behalf, thank you very much indeed for the invitation issued to her to be here at this meeting today. Thank you very much indeed. Madame Grossetête would like to apologise that the fact that she's back in her constituency every end of every week. She's back in her constituency working locally with her constituents. She cannot be here today. She does apologise for that. She's asked me therefore to communicate to you a series of important messages which she takes very, very seriously. Like you, Madame Grossetête is very worried about the increase of antimicrobial resistance. Our Commissioner has been talking about these issues just a few minutes ago. It's an excellent example of the link between animal and human health. This is why one of these subjects has become a priority in her report on revision of the framework of regulation applicable to veterinary staff, veterinary doctors and experts. This is a concrete example of why we need real paths of action in combating antimicrobial resistance to contribute to animal well-being. Madame Grossetête would like to thank very much indeed the Commission's work in contributing to the battle against antimicrobial resistance and its projects and plans. On this particular basis, she's been working on a list of critical substances reserved for human medicine. She'd like also to make further progress on a number of further points. For example, Madame Grossetête regrets that there's a lack of a precise definition by which you can precisely and target, on a targeted basis, use antibiotics in veterinary services prophylactically and in other ways. And she also is working on proposing definitions for these targeted uses. Also, she would like to further restrict the metaphylactic and prophylactic use of antibiotics in breeding, similarly to her other colleagues who have also made a whole series of amendments dealing with these particular issues. Negotiations are ongoing involving the rapporteurs representing the other political groups in order to define a framework on the use of these particular substances. I hope we can discuss this as we go on this afternoon. Let me just say that the use of antibiotics metaphysically or prophylactically must never become a compensation or an alternative or an excuse for avoiding good practice. No, Madame Grossetête would like to define the precise conditions with which veterinary staff are authorised to prescribe and sell these products. Well-known Article 107. She says that antibiotic products should only be made available following a veterinary diagnosis based on a previous examination of the animal. That might appear to be something you take for granted, but actually it hasn't been clear up to now. Another priority, which is very, very close to Madame Grossetette's heart, she's done a lot of work in this area, is the sale online of antibiotic products. She says that that must be banned 100% because it's risky and presents all sorts of hazards. Also, restrict the use of antibiotics is only the start or one of the chapters in a much bigger picture. Madame Grossetête is of the opinion that research in therapies must be promoted in order that new antibiotics can be made available to the market, in particular in the veterinary sector, which is why she'd like to extend the protection of data to be applicable to new antibiotics. This legislation would be a great opportunity for all of us to stop abuse and give a clear framework for the use of antibiotics in veterinary medicine. Madame Grossetête also says it's very, very important that we focus on these texts in great detail, quite forensically, with the various rapporteurs and representatives of the political groups. We hope to complete our political negotiations very near future together with the Council and the Commission. What's at stake here is very, very important indeed. Thank you.